Hey everyone, tonight I want you to imagine for a second that you're planning the most important day of your life, except there's about a 50-50 chance you won't survive it, and everyone around you, they're just okay with that. I know, you're probably thinking about your wedding day, or maybe starting a new job, but I'm talking about something else entirely, something that in our world today, we celebrate with baby showers and gender reveal parties and carefully curated Instagram announcements, something that gets treated like the most natural, beautiful thing in the world. But what if I told you that for most of human history, this same event was basically a coin flip with death? What if the thing we now document with professional photographers and announce with little pink or blue cakes was actually something families prepared for, like a funeral? Tonight we're going back to a time when bringing life into this world meant you were literally gambling with your own. And I want you right there with me, because honestly, the fact that most of us are even here to have this conversation is kind of a miracle. So wherever you are right now, let me know in the comments where you're tuning in from and what time it is where you are. Grab whatever makes you comfortable, because we're going somewhere our great-great-grandmothers feared to go. Pour yourself some tea, dim the lights, maybe grab a blanket, and hey, if you end up appreciating just how incredible modern medicine is after this journey, maybe hit that subscribe button, but only if this kind of historical deep dive actually speaks to you. So let me take you back to a time when bringing life into the world was literally gambling with death. Let me tell you why medieval childbirth was an absolute nightmare. It's 1347, you're a woman in your early 20s, and you've just realized something that changes everything. Your monthly bleeding has stopped, your breasts feel tender, you've been sick every morning for the past week, retching into the chamber pot while your husband sleeps. Congratulations, you're pregnant. Except nobody says congratulations. Your mother looks at you with this expression that's equal parts joy and terror, and you don't understand why until much later. Your husband nods solemnly, like you've just announced someone's death, which honestly, you might have. See, here's the thing about medieval pregnancy that we need to get straight right from the start. There are no pregnancy tests, no ultrasounds, no doctors who specialize in this stuff. Hell, there are barely any doctors at all, and most of them think women's bodies are just weird, broken versions of men's bodies. So you're going to spend the next 9 months guessing about literally everything. You suspect you're pregnant because your body feels different. Maybe you've missed your period. Maybe you're throwing up constantly. Maybe you just have this weird feeling, but you won't know for sure until you're showing. And even then, people might whisper that you're just getting fat, or that you have some kind of growth in your belly. The first person you tell is probably your mother, if she's still alive, which is a big if, considering she's survived her own pregnancies in this delightful medieval world. She looks at you with this mixture of happiness and absolute dread, because she knows what's coming. She's been there. She's seen friends die. She's maybe lost babies herself. God willing, she says. And you realize that's going to be the phrase that defines the next 9 months of your life. God willing, you'll carry to term. God willing, the baby will be healthy. God willing, you'll both survive the birth. God willing, God willing, God willing. Your mother starts telling you things that sound completely insane by modern standards, but this is medieval science we're talking about. Don't look at ugly things, or your baby will be ugly. Don't eat strawberries, or your baby will have birthmarks. Don't raise your arms above your head, or the umbilical cord will wrap around the baby's neck. Don't step over a grave, or you'll have a difficult birth. Then here's the really fun part. Some of these superstitions contradict each other depending on who's giving you advice. Your mother says one thing, your aunt says another. The wise woman down the road says something completely different. Welcome to medieval prenatal care, where everyone's an expert and nobody knows anything. But let's talk about what prenatal care actually looks like in your world. Spoiler alert, it doesn't really exist. You don't have regular checkups. You don't have anyone monitoring your blood pressure or checking if your baby is growing properly. You don't have vitamins or any understanding of nutrition during pregnancy. What you do have is a lot of religious ritual and superstition masquerading as medical care. You'll be encouraged to pray constantly, to wear certain amulets, to avoid certain foods that are considered hot or cold, according to medieval medical theory. You might be told to wear a coral necklace to protect against miscarriage, or to keep a magnet on your body to ease labor pain. The medieval understanding of pregnancy is, let's call it creative. They think the womb is basically a separate animal living inside you, and this animal can move around your body causing all sorts of problems. They believe that what you eat, think, and look at can directly affect your baby's appearance and personality. They think that if you're pregnant with a boy, you'll crave meat and look healthy, but if you're pregnant with a girl, you'll crave sweets and look pale and sickly. Your diet during pregnancy is a nightmare of restrictions and requirements that make no medical sense. You're told to avoid certain foods that might corrupt your baby, but you're also living in a world where food scarcity is common and nutritious food is expensive. You might be told to avoid fish because it's cold and moist, but fish might be one of the few protein sources you can afford. If you're wealthy, you might have access to things like sugar and spices that are considered beneficial for pregnancy. If you're poor, you're eating whatever you can get your hands on and hoping for the best. Either way, you're not getting the nutrients you actually need for a healthy pregnancy because nobody understands nutrition yet. The community around you has very specific expectations about how you should behave during pregnancy. You're expected to be more pious, to pray more, to avoid anything that might be considered sinful or harmful. You're also expected to keep working because pregnancy isn't considered a disability or a medical condition that requires rest. If you're a peasant woman, you're still working in the fields, hauling water, doing heavy labor right up until you go into labor. If you're a merchant's wife, you're still managing the household, supervising servants, dealing with the family business. If you're nobility, you might have a slightly easier time, but you're still expected to fulfill your social obligations. And here's something that would seem completely bizarre to us today. You're probably going to be pregnant a lot. Like, a lot. The average medieval woman who survived to adulthood would be pregnant somewhere between 8 and 15 times in her life. Some women spent basically their entire adult lives either pregnant or nursing. This wasn't by choice. This was survival. Infant mortality was so high that you had to have many children just to ensure some would survive to adulthood. Contraception was basically non-existent and mostly ineffective. And in a world where children were your social security system, you needed surviving children to take care of you in old age. So you're not just dealing with one pregnancy, you're dealing with the reality that this is probably going to be your life for the next 20 years. Pregnant, give birth, nurse for a while, get pregnant again, repeat until you either die in childbirth or go through menopause. The psychological toll of this reality is something we can barely imagine today. You're living with the constant awareness that every pregnancy could be your last. You're watching friends and family members die in childbirth regularly. You're losing babies to miscarriage, stillbirth, and infant death, and you're expected to just keep going. Your husband's reaction to your pregnancy is probably relief, mixed with anxiety. Relief because having children is essential for the family's survival and continuation. Anxiety because he knows the statistics as well as you do. He's probably lost a previous wife in childbirth, or his mother died having him, or he's watched his sisters and female relatives go through this. But here's the thing that really gets me about medieval pregnancy. Despite all of this, despite the danger and the uncertainty and the complete lack of medical care, women still wanted children. They still loved their babies. They still hoped and planned and dreamed about their children's futures. They made tiny clothes and prepared nurseries and chose names, all while knowing that there was a very real chance none of it would matter. The strength that required, the courage to keep hoping in the face of such overwhelming odds, is something that just floors me every time I think about it. As your pregnancy progresses, you'll start preparing for the birth itself. This isn't just about getting baby clothes ready, though you'll do that too, sewing tiny gowns and blankets by candlelight. This is about preparing for the very real possibility that you might die. You'll make arrangements for your children if you have them. You'll write letters to be given to your baby if you don't survive. You'll confess your sins and get right with God, because entering childbirth is like entering battle. You might not come out alive, and all of this is just the beginning. We haven't even gotten to the actual birth yet, and already you're living in a world where pregnancy itself is a form of Russian roulette. Every symptom could be normal, or it could be a sign that something is going horribly wrong. Every pain could be the baby moving, or it could be the beginning of a miscarriage. You don't have any way to know if your baby is healthy, if you're developing complications, if you're going to make it through this pregnancy. You just have to live with the uncertainty,
day after day, month after month, until the birth either goes well or it doesn't. Welcome to medieval pregnancy, where hope and terror walk hand in hand, and where the miracle of life comes with a price tag that's written in blood. So you're 6 months pregnant now, and it's time to start thinking about who's going to help you when the big day comes. In our world, you'd be interviewing doctors, touring hospitals, maybe hiring a doula. You'd have options, credentials to check, reviews to read online. In your medieval world, you get Margaret. Margaret is the local midwife, and she's your only option. She's probably in her 50s, has delivered dozens of babies, and learned everything she knows from watching her mother do it before her. Her credentials: she's still alive, which honestly makes her more qualified than most people.
Here's the thing about medieval midwives that might surprise you. They weren't the wise, mystical healers that modern romanticized versions make them out to be. They were just women. Usually older women who had survived multiple pregnancies themselves and had picked up some knowledge along the way. Think of it like this. If your neighbor had helped a bunch of people change their car tires, you might ask them to help you change yours. Except instead of a flat tire, it's a human life hanging in the balance. Margaret learned midwifery the same way medieval people learned everything, by watching and hoping for the best. Her mother might have been a midwife, or maybe Margaret just started helping out at births in her community and gradually became the go-to person. There's no medical school for midwives, no licensing exam, no board certification. Her training consists of, I've done this before, and my mother told me this works. And here's what makes this even more terrifying. Margaret might be illiterate. Most people are in your time period, so all of her knowledge is passed down orally, which means it's like a centuries-long game of telephone, where the message is how to keep people from dying in childbirth. But let's talk about Margaret's toolkit, because this is where things get really medieval. Her medical bag contains, well, not much that would be medically useful. She's got some herbs that might help with pain or bleeding, but their effectiveness is basically a coin flip. She's got some string for tying off the umbilical cord. She might have a small knife for cutting it. And that's about it for actual medical supplies. The rest of her toolkit is pure medieval mysticism. She's got holy relics, maybe a piece of wood that's supposedly from the Virgin Mary's birthing bed, or a stone that's been blessed by a saint. She's got charms and amulets, special prayers she recites, specific rituals she performs. She might even have what she believes is a unicorn horn, which medieval people thought could cure everything from poison to difficult births. Margaret's understanding of anatomy is creative. She knows that babies come out of women, and she's observed the basic process many times. But she doesn't understand how pregnancy actually works, what can go wrong medically, or how to intervene when complications arise. She thinks the womb is basically a separate creature living inside you that needs to be coaxed and persuaded to do its job. When you go into labor, Margaret's treatment plan is going to involve a lot of prayer, some herbal remedies that may or may not help, and basically hoping that nature takes its course successfully. If things go well, she'll take credit for her skill. If things go badly, it's God's will or the devil's interference. Now here's where it gets interesting. Male physicians exist in your world, but they generally don't get involved in childbirth. Why? Because childbirth is considered women's work, and also because male doctors think they're too important to deal with something as common and messy as birth. They're busy with important things like bloodletting and analyzing urine. When male physicians do get involved in childbirth, they usually make everything worse. They've read ancient texts that are completely wrong about female anatomy. They believe in medical theories that have no basis in reality, and they've never actually seen a birth, because it would be improper for a man to be present. If you're wealthy enough to afford a physician's consultation during your pregnancy, he might examine your urine, feel your pulse, and make pronouncements about your health based on completely incorrect medieval medical theory. He might prescribe treatments that are useless or actively harmful, and then he'll charge you a fortune for the privilege of making your situation worse. But back to Margaret. She's got experience, and in a world without actual medical knowledge, experience is the best you can hope for. She's seen every kind of birth complication, and while she might not understand the medical reasons behind them, she's developed some practical knowledge about what works and what doesn't. Margaret knows that sometimes turning the baby helps with difficult deliveries. She knows that certain herbs can help slow down bleeding after birth. She knows that keeping the birthing chamber warm and the mother calm can make things go more smoothly. She's developed her own techniques for dealing with common problems, and some of them might actually be helpful. She's also your psychological support system, which is honestly more important than you might think. Margaret has been through this with dozens of women. She knows what normal labor looks like, and she can reassure you when things are progressing as they should. She's seen women survive births that looked hopeless, and she's got stories to tell you about their courage and strength.
But here's the dark side of medieval midwifery. Margaret has also seen a lot of women die. She's lost mothers to hemorrhaging, to infection, to complications she couldn't understand or treat. She's delivered stillborn babies and watched families grieve. She carries the weight of every woman she couldn't save, and she knows that despite all her experience, she might not be able to save you either. The relationship between you and Margaret is complicated. She's your lifeline, your expert, your guide through the most dangerous experience of your life. But she's also someone who might be completely powerless if things go wrong. You're depending on her to save you, and she knows that her abilities have very real limits.
Margaret charges for her services. Of course, if you're wealthy, you might pay her in coins. If you're poor, you might pay her in goods, grain, cloth, livestock, whatever you can afford. If you're really poor, your family might promise to pay her after the harvest, or offer her meals and shelter in exchange for her help. The payment isn't just for the birth itself. Margaret might come to check on you during your pregnancy, especially if you're having problems. She'll definitely be there for the birth, which could take hours or even days, and she'll stay with you for several days after the birth to make sure you're recovering properly. Now here's something that would seem weird to us today. Margaret isn't just your medical provider, she's also your spiritual advisor during the birth. She knows the prayers that are supposed to help with difficult labors. She knows which saints to invoke for protection. She might even have special religious rituals that she performs to ensure a safe delivery. This mixing of medicine and religion isn't unusual in medieval times. It's how everything works. Margaret sees her role as both medical and spiritual because medieval people don't really separate those things. Your physical health and your spiritual health are considered intimately connected, so treating one requires addressing the other. Margaret also has social responsibilities in your community. She's often the person who determines whether a birth was natural or whether there was something supernatural involved. If you have a baby with birth defects, Margaret might be asked to determine whether it was caused by sin, witchcraft, or just bad luck. Her word carries weight in these matters. She's also usually the person who performs emergency baptisms if a baby is born in distress. In medieval Christian belief, unbaptized babies can't go to heaven, so if it looks like your baby might not survive, Margaret will baptize them immediately. This is sometimes the difference between your baby being buried in consecrated ground or not. The scary thing about depending on Margaret is that she's flying blind most of the time. She doesn't understand the underlying medical processes that cause complications. She doesn't know about infections or how to prevent them. She doesn't understand the mechanics of difficult births or how to correct them safely. What she has is pattern recognition. She's seen this situation before, and she remembers what happened. Sometimes that's enough. Sometimes her experience and practical knowledge can guide her to the right decision, but sometimes the pattern doesn't match, or the situation is genuinely unprecedented, and then she's just guessing. The really tragic thing is that Margaret wants to help. She's not a charlatan or a fraud. She genuinely believes in her methods and wants to save both you and your baby. She's developed her techniques through years of trial and error, keeping what seems to work and discarding what obviously doesn't. But she's working without any understanding of the science behind birth, so she's essentially practicing medicine by superstition and hope. And here's the thing that really gets to me about medieval midwives like Margaret. They carry an enormous psychological burden. Every woman who dies under their care, every baby who doesn't survive, every family that's devastated by loss, Margaret feels responsible for all of it. She doesn't have the comfort of knowing that she did everything medically possible, because she doesn't know what's medically possible. She lives with the constant awareness that she might not be able to save the next woman who needs her help. She knows that families are putting their complete trust in her abilities, and she knows that sometimes her abilities won't be enough. But she keeps doing it, because someone has to, and she's the best option available. So when your labor starts, and your family sends for Margaret, she comes. She brings her bag of herbs and charms and prayers, her years of experience, her practical knowledge, and her hope that this time, everything will go well. She's your only hope in a world without real medical care, and she knows it. And honestly, sometimes that's enough. Sometimes experience and practical knowledge and sheer determination can overcome the odds. Sometimes Margaret's ministrations actually help. Her presence provides comfort, and her expertise guides you through a successful birth. But sometimes it's not enough, and that's the nightmare of medieval childbirth. Not just that the odds are against you, but that the person you're depending on to beat those odds is working with tools and knowledge that are centuries away from being adequate to the task. It's 3 in the morning, on a cold February night in 1347, and you wake up to a pain that feels like someone's wrapping iron bands around your belly and tightening them with a winch. You lie there for a moment, hoping it's just the baby moving, but then it happens again and again. This is it. This is the moment you've been preparing for and dreading in equal measure for the past 9 months. You wake your husband, and he immediately goes into crisis mode, not because he's going to help you. Oh no, that's not how this works. Men don't belong in the birthing chamber. Instead, he's running through the village in the dark, pounding on doors, gathering the women who will see you through this ordeal. Margaret the midwife, your mother, if she's still alive, your sisters, your female neighbors, the sisterhood of women who understand that this night could go either way.
While he's doing that, you're lying in bed, timing these pains, and trying not to panic. Each contraction feels like your body is trying to tear itself apart from the inside. And here's the thing that would absolutely shock us today. You have no pain relief. None. No epidural, no gas and air, no even aspirin. The closest thing you have to pain management is maybe some wine or ale. And even that's controversial, because some people think it's bad for the baby. Your pain relief options are basically prayer, breathing, and biting down on something so you don't scream too loudly and disturb the neighbors. By the time Margaret arrives, you're in full labor, and she immediately takes charge of transforming your bedroom into what medieval people called the birthing chamber. This isn't just about medical preparation, it's about creating a sacred space where the dangerous work of bringing life into the world can happen. First, all the men are banished. This isn't optional. It's absolutely forbidden for men to be present during childbirth. Your husband, your father, your brothers, even your male servants, they all have to leave. This is women's work, women's mystery, and men are considered not just useless, but actually harmful to the process. The birthing chamber becomes an exclusively female space, and the atmosphere is intense. Margaret starts by blessing the room, saying prayers, hanging holy relics on the walls. She might sprinkle holy water around the bed, light blessed candles, place religious icons where you can see them. This isn't just superstition. In a world where medical intervention is limited, spiritual intervention is considered just as important. The other women arrange themselves around the room according to their roles. Your mother, if she's there, becomes your primary emotional support. Your sisters or close female relatives become your physical support. They'll hold your hands, wipe your face, help you change positions. The other women present serve as witnesses, assistance and backup support. And here's something that might surprise you. The birthing chamber is actually designed to be as comfortable as possible within medieval limitations. The women bring soft linens, extra pillows, maybe even some of your favorite foods or drinks. They light a fire to keep the room warm, bring in extra candles so there's plenty of light, and try to create an atmosphere that's as calm and supportive as they can make it. But underneath all this preparation, there's an undercurrent of tension that everyone can feel. Every woman in that room has either experienced childbirth herself or attended births that didn't end well. They know the statistics. They know that no matter how well prepared they are, how experienced Margaret is, how strong you are,
This could still go horribly wrong. Margaret starts her examination, which is, well, let's just say it's not like a modern medical exam. She doesn't have gloves. She doesn't have proper sterilization. She doesn't really understand what she's looking for beyond the basics. She feels your belly to try to determine the baby's position, listens to your symptoms, and makes her best guess about how your labor is progressing. Based on her assessment, she starts her treatment protocol, which is a mixture of practical knowledge and medieval superstition. She might give you herbs to chew or drink, things like raspberry leaf, which actually can help with labor, or pennyroyal, which is supposed to speed things up, but can actually be dangerous. She might have you hold certain objects that are supposed to ease birth pains, or recite specific prayers. One thing Margaret definitely does is position management. Medieval midwives understood that different positions could help with labor, even if they didn't understand the mechanical reasons why. You might labor standing up, squatting, kneeling, or lying on your side. Margaret might have you walk around the room during early labor, or lean against the other women for support. The birthing chair is a big deal, if your family can afford one. It's basically a chair with a hole in the seat that allows you to sit upright while giving birth. This position actually makes a lot of sense from a modern medical perspective. Gravity helps, and the upright position can make pushing more effective. But most families can't afford a birthing chair, so you'll probably end up giving birth in bed or on a birthing stool. As your labor progresses, the atmosphere in the room becomes more intense. The women start telling you stories about their own births, sharing advice, offering encouragement. They might sing songs or recite prayers together. There's a real sense of female solidarity here. These women understand what you're going through because they've been through it themselves. But there's also growing anxiety as the hours pass. In modern hospitals, labor that goes on too long is cause for medical intervention. In your medieval world, prolonged labor just means more time for things to go wrong, and there's not much anyone can do about it. Margaret tries different techniques to speed things up. She might give you stronger herbs, have you change positions more frequently, or perform what she considers medical interventions. She might massage your belly, or apply heat or cold to different parts of your body. Some of these techniques are actually helpful, but others are just medieval medical theater. The other women in the room start getting more worried. As time goes on, they've all heard stories about labors that went on for days, about women who exhausted themselves pushing, about babies who got stuck. They're watching for signs that something might be going wrong, but they don't really know what to look for beyond the obvious. And here's where the medieval birthing chamber becomes truly horrifying. When complications arise, there's almost nothing anyone can do about them. If your baby is in the wrong position, Margaret might try to turn them manually, but she's working blind and without proper technique. If you start bleeding heavily, she might try to stop it with pressure or herbs, but she doesn't understand what's causing it, or how to address the underlying problem. If your labor stalls completely, if you're too exhausted to push, if the baby gets stuck, these are all death sentences that everyone in the room recognizes but can't do anything about. The women might pray harder, Margaret might try more desperate remedies, but ultimately they're just waiting to see whether you and your baby will survive. The psychological atmosphere during a difficult medieval birth is something we can barely imagine today. The women in the room are watching someone they love struggle with a process that could kill her, and they're essentially powerless to help beyond offering comfort and support. They're witnesses to a battle between life and death, and they know that all their prayers and remedies and experience might not be enough. Margaret, as the supposed expert, carries the heaviest burden. She's the one everyone looks to for solutions when things go wrong. She's the one who has to make decisions about whether to try risky interventions or just wait and hope. She's the one who will be blamed if you die, and praised if you survive, even though the outcome is largely out of her control. The hours drag on. Medieval labor often lasted much longer than modern labor because women were generally less healthy, often malnourished, and frequently exhausted from previous pregnancies and constant physical work. A labor that lasted 24 hours or more wasn't unusual, and some women labored for days. During this extended ordeal, you're dealing with pain that's beyond description, exhaustion that makes you feel like you're drowning, and the growing awareness that this might not end well. The women around you try to keep your spirits up, but you can see the fear in their eyes. You can hear the whispered conversations when they think you can't listen. You know that they're starting to worry that you might not make it through this. And then there are the complications that everyone fears but no one talks about directly. Breech births, where the baby is coming out backwards or sideways. Hemorrhaging that won't stop. Signs that the baby might already be dead. Prolapsed cords. Twins, which double the danger and the complexity. When these complications arise, the birthing chamber becomes a place of barely controlled panic. Margaret might try techniques she's heard about but never performed. The other women might send for additional help, maybe another midwife, maybe a priest to perform last rites, maybe just more women to assist with whatever needs to be done. But here's the most heartbreaking part of medieval childbirth. Even when everyone in the room can see that something is going terribly wrong, there's often nothing they can do but wait and pray. They don't have surgical options. They don't have medical instruments beyond the most basic tools. They don't have blood transfusions or antibiotics or any of the interventions that could save your life. They just have each other, their limited knowledge, their herbs and prayers and superstitions, and their desperate hope that somehow, against the odds, you and your baby will both survive this ordeal. As the night wears on, and your labor continues, the birthing chamber becomes a microcosm of medieval life itself, a place where hope and despair exist side by side, where human courage faces impossible odds, where love and loss are separated by the thinnest of margins. The women around you are doing everything they know how to do. Margaret is using every technique she's learned in decades of attending births. You're fighting with every ounce of strength you have, and still the outcome remains terrifyingly uncertain. This is medieval childbirth, not just a medical event, but a confrontation with mortality itself, played out in a small candlelit room, with only other women as witnesses to your struggle between life and death. You've been in labor for 18 hours now, 18 hours of pain that comes in waves, each one feeling like it might split you in half. Margaret keeps saying you're progressing well, but you can see the worry lines deepening around her eyes. The other women have stopped making cheerful small talk and started speaking in hushed whispers when they think you can't hear them. Something is wrong. You don't need medical training to know it. You can feel it in your body, see it in Margaret's increasingly frantic attempts at intervention, hear it in the way your mother's voice cracks when she tries to reassure you. This is when medieval childbirth reveals its true horror, not in the normal successful births that Margaret has guided through safely, but in the moments when the process that's supposed to bring life instead threatens death. And in your world, when things go wrong during childbirth, they tend to go very, very wrong.
Let's talk about what prolonged labor means in medieval terms. Today, if your labor stalls or goes on too long, you get a C-section. Problem solved. Everyone lives. In 1347, prolonged labor means you're slowly dying while everyone watches helplessly. Your body is exhausted. You haven't eaten properly in almost a day because Margaret believes eating during labor is dangerous. You've been losing fluids through sweat and blood, and there's no such thing as an IV to keep you hydrated. Your muscles are cramping, your strength is failing, and you're starting to feel that terrifying weakness that comes when your body begins to shut down. Margaret tries everything she knows. She makes you walk around the room, even though you can barely stand. She has you squat over a pot of steaming herbs, hoping the vapors will somehow help. She gives you increasingly potent herbal mixtures that make you vomit, which only weakens you further. She prays louder, brings in more holy relics, even sends someone to fetch water that's been blessed by a priest. But here's the nightmare scenario that keeps medieval women awake at night. What happens when the baby gets stuck? In our world, if a baby is too big for the birth canal, or positioned wrong, or if there are other mechanical problems, Surgeons can intervene. In your medieval world, if the baby gets stuck, that's often a death sentence for one or both of you. Margaret might try to reach inside and turn the baby manually. She's done this before, and sometimes it works, but she's working without any understanding of anatomy, without proper tools, without sterile conditions. Her hands aren't clean by modern standards. She doesn't know about the risk of infection. She's essentially performing surgery with no surgical training, guided only by desperation and whatever she learned from watching other midwives attempt the same thing. If she can't turn the baby, if her manual manipulation doesn't work, then she's faced with a choice that no human being should ever have to make: try to save you, or try to save the baby. In medieval times, this choice often came down to a brutal calculation. If the baby is clearly stuck, and both of you are going to die, Margaret might try to dismember the baby inside the womb to save your life. This isn't a medical procedure. It's a desperate act of survival performed with primitive tools by someone who's probably never done it before. The instruments she might use for this are basically medieval torture devices: hooks to grab onto the baby, knives to cut, crude forceps to pull. There's no anesthesia for you, no sterile environment, no understanding of how to minimize damage to your body. It's butchery performed in the hope that at least one of you might survive. And here's the part that really gets to me. If Margaret makes the choice to try to save the baby instead of you, the procedure is even more horrifying. She might try to cut you open while you're still alive, hoping to get the baby out before you both die. This isn't a cesarean section as we understand it. It's a desperate, usually fatal attempt to save an infant from a dying mother. Medieval records show that cesarean sections were almost always performed on women who had already died, or were clearly dying. The procedure wasn't designed to save the mother. It was designed to save the baby and allow for emergency baptism. Survival rate for the mother, essentially zero. But let's say the baby isn't stuck. Let's say your prolonged labor is due to other complications. Maybe you're hemorrhaging. Postpartum hemorrhaging is one of the leading causes of maternal death even today, with all our modern medical interventions. In medieval times, if you started bleeding heavily during or after birth, your chances of survival plummeted. Margaret's treatment for hemorrhaging is, well, it's not really treatment. She might try to stop the bleeding by applying pressure, but she doesn't understand what's causing it or how to address the underlying problem. She might give you herbs that are supposed to help with bleeding, but most of them are useless or actually make things worse. If the bleeding doesn't stop, Margaret and the other women can only watch as you slowly bleed to death. They might try increasingly desperate remedies, special prayers, more powerful herbs, even bloodletting, which is the medieval cure for everything and makes hemorrhaging worse. But ultimately, they're helpless against a medical emergency that requires surgical intervention they can't provide. The psychological horror of this scenario is almost unbearable. The women in your birthing chamber are watching someone they love die slowly, and there's nothing they can do about it. Margaret knows her limitations, but she also knows that families expect her to perform miracles. The pressure she's under in these moments is crushing. Then there's childbed fever, what we now know as puerperal sepsis, a bacterial infection that can kill new mothers. In medieval times, this was often considered a mysterious curse that struck seemingly healthy women after successful births. You survive the delivery, everything seems fine, and then a few days later you develop a fever. You become weak, confused, delirious. Your body aches, you can't keep food down, and you can feel yourself getting sicker by the hour. Margaret doesn't understand that this is caused by bacterial infection, probably introduced during the birth process by unsterile hands and instruments. She thinks it might be caused by bad air or an imbalance in your bodily humors or divine punishment for some sin. Her treatments, more bloodletting, purging, herbs that do nothing, are not just useless but often make the infection worse. Childbed fever killed women who had survived the most dangerous part of childbirth. It was cruel and arbitrary. You could go through labor successfully, deliver a healthy baby, and then die anyway from an infection that modern antibiotics could cure in days. Now, let's talk about multiple births, because if one baby is dangerous, two babies are often fatal. Twins aren't always detected before birth in medieval times. The first sign might be when Margaret delivers one baby and realizes there's another one still inside you. This is a nightmare scenario because you've already been through a full labor and delivery. You're exhausted and possibly injured, and now you have to do it all over again. The second baby is often positioned differently than the first, which can cause additional complications. You might hemorrhage between the two deliveries. The second baby might be stillborn. You might not have enough strength left to deliver the second baby successfully. Margaret has probably never delivered twins before. Most midwives haven't, because multiple births are relatively rare and most don't survive. She's making it up as she goes along, trying techniques she's heard about but never performed, hoping that something works. The mortality rate for twin births in medieval times is staggering. Most of the time, everyone dies, both babies and the mother. Sometimes one baby survives. Very rarely, everyone makes it through alive. But here's perhaps the most heartbreaking complication of all, when it becomes clear that the baby has already died inside you. Stillbirth is common in medieval times, but detecting it before birth is nearly impossible. The first sign might be when you go into labor and the baby doesn't cry, doesn't move, doesn't breathe. Or worse, when the baby has been dead for days or weeks inside you and has started to decompose. Margaret still has to help you deliver a dead baby, knowing that the process could kill you too. She has to perform all the same procedures, take all the same risks, endure all the same pain of labor, for a baby who will never take a breath. The psychological trauma of this is something we can barely comprehend. You've spent 9 months preparing for motherhood, enduring pregnancy, planning for your child's future. You've survived the ordeal of labor, and then you're handed a tiny body that will never live. But the medical complications don't end there. A dead baby can cause infection, can be more difficult to deliver, can increase the risk of hemorrhaging. Sometimes pieces of the placenta are retained, leading to infection and death weeks later. Margaret has to navigate not just the medical aspects of stillbirth, but the emotional and spiritual ones too. She has to help you grieve, while also monitoring you for signs of infection or other complications. She has to perform the baby's baptism, even stillborn babies are baptized in medieval times, and help your family prepare for a funeral instead of a celebration. And through all of these complications, through all of these scenarios where everything goes wrong, Margaret is working without any of the tools that could actually help. No antibiotics for infection, no surgical options for mechanical problems, no blood transfusions for hemorrhaging, no understanding of sterile technique, no anesthesia for pain. She's fighting medieval childbirth's deadliest complications with medieval remedies, and medieval remedies are often worse than useless. She's bringing prayers and herbs to a gunfight, and she knows it. The women in your birthing chamber know it too. They can see when Margaret starts trying increasingly desperate remedies. They can tell when she's run out of options and is just going through the motions, hoping for a miracle. They know that despite all their preparation, all their experience, all their love and support, some battles can't be won. This is the deadly dance of medieval delivery, a choreography of hope and despair, knowledge and ignorance, love and loss. It's performed in birthing chambers across medieval Europe every day, and most of the time, when things go seriously wrong, the dance ends in tragedy. The miracle isn't that some women died in childbirth during medieval times. The miracle is that any of them survived. The baby's cry pierces the exhausted silence of the birthing chamber, and for a moment, everyone just stops breathing. After 22 hours of labor, after all the fear and pain and desperate prayers, you've done it. The baby is alive, you're alive. Against medieval odds that would make a Vegas bookie weep, you've both survived. Margaret cuts the umbilical cord with her small knife, ties it off with string, and places your baby on your chest. The other women in the room start crying, tears of relief, of joy, of sheer disbelief that this story ended well. Your mother kisses your forehead and whispers prayers of thanksgiving. Someone sends word to your husband that he can stop pacing in the courtyard because he's now a father.
Congratulations. You've just accomplished something that kills roughly 1 in 3 women in your time period. You've beaten odds that would terrify anyone with a basic understanding of statistics. You are now a medieval childbirth survivor. But here's the thing about surviving medieval childbirth. The danger isn't over, not even close. In fact, some of the deadliest complications are just getting started. Welcome to what medieval people call the lying-in period, and what we might call the 4 weeks where everything can still go horribly wrong. First, let's talk about your immediate condition. You've just been through an ordeal that would hospitalize you for days in our world, but in medieval times, you're expected to be up and functioning relatively quickly. You're exhausted. You're probably torn from the birth. You might be anemic from blood loss, and you're in significant pain. But there's no such thing as a recovery room. No pain medication, no medical monitoring. Margaret will stay with you for a few days to make sure you're not developing any immediate complications. But her post-birth care is about as primitive as her birth assistance. She might give you herbs that are supposed to help with healing, but most of them do nothing. She might apply poultices or ointments that are more likely to cause infection than prevent it. She definitely doesn't understand the importance of keeping wounds clean or watching for signs of infection. The first major threat you face is postpartum infection. Remember how Margaret delivered your baby without gloves, without sterilized instruments, without any understanding of bacteria? Well, all those germs she introduced during the birth process are now having a party in your reproductive system. Puerperal sepsis, childbed fever, can develop days or even weeks after a seemingly successful birth. It starts with a low-grade fever, maybe some unusual discharge, feeling more tired than you should. But these symptoms are easy to dismiss as normal recovery, especially when nobody around you understands what to look for. If the infection takes hold, you'll develop a high fever, severe abdominal pain, nausea and confusion. Your body will start shutting down as the infection spreads through your bloodstream, and there's absolutely nothing anyone can do about it. No antibiotics, no surgical intervention, no understanding of what's causing your symptoms. Medieval medical theory attributes childbed fever to bad air or an imbalance in your bodily humors. The treatments, bloodletting, purging, more herbs, actually make the infection worse by weakening your immune system further. You could survive the most dangerous birth complications, only to die from an infection that modern medicine can cure with a course of antibiotics. Then there's the issue of bleeding. Even if you didn't hemorrhage during the birth, you're still bleeding for weeks afterward, as your body recovers. This is normal, but medieval people don't really understand what normal postpartum bleeding looks like versus dangerous bleeding. If you start bleeding heavily days or weeks after the birth, Margaret might not recognize it as a medical emergency until it's too late. Your diet during recovery is, well, let's just say it's not designed to promote healing. Medieval people believe that new mothers should avoid certain foods that are considered cold or moist. According to their medical theories, you might be forbidden from eating fresh fruits or vegetables, drinking cold water, or consuming protein-rich foods that would actually help your body recover. Instead, you're probably eating a lot of bread, maybe some watery porridge, possibly some ale or wine for medicinal purposes. If your family is wealthy, you might have access to some meat or cheese, but your overall nutrition is probably terrible exactly when your body needs it most. Breastfeeding brings its own set of medieval nightmares. If you're wealthy enough, you might hire a wet nurse, another woman who will breastfeed your baby for you. This was actually considered healthier for upper-class women, because breastfeeding was thought to weaken the mother and interfere with her ability to conceive again quickly. But if you're breastfeeding yourself, you're facing complications that nobody understands how to treat. Mastitis, infection of the breast tissue, is common and can be fatal if it spreads. Cracked, bleeding nipples can become infected. If your milk supply is inadequate, your baby might starve, but there's no reliable alternative to breast milk. Medieval people have some truly bizarre beliefs about breastfeeding. They think that strong emotions can curdle your milk and poison your baby. They believe that having sex while nursing will contaminate your milk. They think that what you eat directly affects the baby's personality. So if you eat too much garlic, your baby will be hot-tempered. If breastfeeding doesn't work out, your options for feeding your baby are limited and dangerous. Animal milk isn't safe because there's no pasteurization and no understanding of hygiene. Wet nurses might not be available or affordable. Some families try feeding babies a mixture of water, honey, and bread, which is basically a recipe for malnutrition and death. Speaking of your baby, let's talk about infant mortality rates that would shock us today. Even if your baby survived the birth, their chances of living to their first birthday are about 50%. The chances of surviving to age 5 are even lower.
Babies die from infections, from feeding problems, from genetic conditions that nobody understands, from accidents, from diseases that are completely preventable today. SIDS, sudden infant death syndrome, kills babies with no warning and no explanation.
whooping cough, measles, pneumonia, diarrheal diseases. All of these are potential death sentences for medieval infants. As a new mother, you're living with the constant awareness that your baby might not survive. You love them desperately, but you also have to protect yourself emotionally from the very real possibility that they'll die. Some medieval mothers didn't even name their babies until they were several months old, because infant death was so common. This creates a psychological burden that's almost impossible for us to understand today. You're bonding with your baby while simultaneously preparing yourself for their potential death. You're celebrating their existence while being acutely aware of how fragile that existence is. And here's something that would seem surreal to modern parents. You need to get pregnant again as soon as possible. In medieval times, children are your insurance policy for old age, your labor force, your continuation of the family line. With such high infant and child mortality rates, you need to have many children to ensure that some survive to adulthood. So even while you're recovering from this birth, even while you're nursing this baby, even while you're dealing with all the complications and infections and fears that come with medieval motherhood, you're expected to conceive again within a year or two. This means you'll be pregnant or nursing almost continuously throughout your childbearing years. Your body never gets a chance to fully recover between pregnancies. Each birth weakens you further, making the next pregnancy more dangerous. It's a cycle that continues until you either die in childbirth or reach menopause. The psychological toll of constant pregnancy and the ever-present threat of death is something that medieval women just had to live with. There was no therapy, no understanding of postpartum depression, no support for the trauma of losing children. You were expected to be grateful for surviving, to love the children you had while they lived, and to keep trying for more. Let's talk about what lying in actually means in practical terms. For about a month after giving birth, you're supposed to stay in bed, avoid physical exertion, and focus on recovering. This sounds nice in theory, but remember, you're still responsible for running your household, caring for your other children, and contributing to your family's economic survival. If you're a peasant woman, you can't afford to lie in bed for a month. You need to get back to work in the fields, tend to your animals, prepare food for your family. If you're a merchant's wife, you need to help run the business. If you're nobility, you have social obligations that can't wait for your recovery. So lying in becomes more of a guideline than an actual practice for most women. You rest when you can, but you keep working because your family's survival depends on it. The social dynamics around new motherhood in medieval times are complicated. On one hand, you've just accomplished something that's considered miraculous. You've brought new life into the world and survived the process. On the other hand, you're now responsible for keeping that life alive in a world where death is constantly present. Other women in your community will help when they can, but everyone has their own children, their own responsibilities, their own struggles. The support network that exists is based on reciprocity. You help others when they give birth, and they help you. But this system only works if enough women in your community survive their own childbirths to provide help. The religious aspects of post-birth recovery are significant too. You need to be churched, undergo a purification ceremony, before you can participate fully in community religious life again. This reflects medieval Christianity's complicated relationship with childbirth, which is simultaneously seen as blessed and as somehow contaminating. Your baby needs to be baptized as soon as possible, because unbaptized babies can't go to heaven, according to medieval Christian belief. If your baby seems weak or sickly, this becomes urgent. Sometimes babies are baptized immediately after birth, if there's any doubt about their survival. And through all of this, the infection risks, the breastfeeding complications, the constant threat to your baby's life, the pressure to get pregnant again, the inability to rest properly. You're supposed to be grateful. You're supposed to feel blessed. You're supposed to be happy that you've become a mother. And you know what? Most medieval women were happy, despite everything. They loved their children fiercely. They found joy in their babies' smiles, their first words, their small daily miracles. They celebrated every milestone, every day their children stayed healthy, every sign that their babies might actually survive to grow up. The capacity for joy in the face of such overwhelming odds, the ability to love completely, while knowing that loss is always possible, the strength to keep hoping and trying and caring despite all the dangers. That's the real miracle of medieval motherhood. You survived childbirth. Congratulations. Now the real work begins.
So we've walked through the nightmare of medieval childbirth together, felt the terror in those birthing chambers, witnessed the impossible choices and tragic losses. But here's what I want you to understand. This wasn't just individual tragedy. This was the engine that drove medieval society, the hidden force that shaped everything from economics to politics to the very structure of civilization itself. Think about it this way. When 1 in 3 women dies giving birth, that's not just a medical statistic. That's a social catastrophe happening over and over again, generation after generation, for centuries. And medieval society had to organize itself around this brutal reality. Let's start with the economics, because medieval childbirth was fundamentally an economic calculation wrapped in human tragedy. In our world, children are expensive. We spend hundreds of thousands of dollars raising them, and they don't really contribute economically until they're adults. But in medieval times, children were your retirement plan, your insurance policy, your labor force, and your only shot at immortality, all rolled into one. You needed children to work your land, help with your trade, support you in old age, and continue your family line. But with infant mortality rates around 50% and maternal mortality rates that would make your hair stand on end, having enough children to ensure some survived required a continuous cycle of pregnancy that often killed the mothers. This created what economists would call a demographic trap. Families needed many children to survive economically, but having many children was extremely dangerous for mothers. Society needed population growth to maintain itself, but the very process of creating that population was killing huge numbers of reproductive age women. The result was a society where women's primary economic value was their ability to produce and raise children, despite the fact that this job had a mortality rate higher than being a medieval soldier. Women were simultaneously precious because they were essential for reproduction, and expendable because individual women could be replaced by others. This economic reality shaped medieval marriage patterns in ways that would seem bizarre to us today. Girls were married young, often as soon as they reached puberty, because their childbearing years were limited and dangerous. Families wanted to maximize the number of children a woman could produce before she died in childbirth. Men often remarried quickly after their wives died, not necessarily because they were heartless, but because a household needed a woman to manage it and produce children. Widowers with children needed someone to care for them. Widowers without children needed someone to produce heirs. The economic pressure to remarry was enormous. This created a society where serial monogamy was common, but not by choice. A successful medieval man might go through 3 or 4 wives during his lifetime, not because of divorce, but because his wives kept dying in childbirth. Some medieval records show men who outlived 5 or 6 wives, each one dying after producing a few children. The class differences in maternal mortality were stark, and they had profound effects on medieval social structure. Wealthy women had access to better nutrition. They weren't doing heavy physical labor during pregnancy. They could afford the best midwives available, and they had more help during recovery. Their survival rates were higher
which meant noble families could maintain their bloodlines more successfully than peasant families. This contributed to the stability of the aristocratic class. Noble families weren't just maintaining their wealth and power through inheritance, they were literally more likely to survive biologically. Poor families, meanwhile, were constantly being decimated by maternal and infant mortality, making it harder for them to accumulate wealth or social position across generations. The regional variations in medieval childbirth practices created fascinating differences in survival rates across Europe. In some areas, midwifery was more developed, with better training and more effective techniques. In others, superstition and harmful practices dominated. These differences contributed to varying population growth rates and economic development patterns across medieval Europe. For example, areas with better midwifery practices tended to have more stable populations, which allowed for more complex economic development. Regions where maternal mortality was extremely high struggled to maintain their population levels, which limited their economic and military potential. The religious implications of medieval childbirth were enormous and shaped Christian theology in ways we still see today. The association of childbirth with pain, danger, and death was interpreted through the lens of original sin. Women suffered in childbirth because of Eve's transgression in the Garden of Eden. This theological framework made the horror of medieval childbirth seem not just inevitable, but morally necessary. Women's suffering during birth was seen as divine punishment, which discouraged efforts to improve medical care or develop better birthing practices. Why try to reduce suffering that God had ordained? The cult of the Virgin Mary became incredibly important, partly because she represented an idealized version of motherhood. She gave birth without the usual pain, danger, and death associated with the process. For medieval women facing their own pregnancies, Mary offered hope that childbirth could be different, even if that hope was largely unrealistic.
Saints associated with childbirth became some of the most popular in medieval Christianity. Women prayed desperately to Saint Margaret of Antioch, Saint Gerard Majella, and others, hoping for protection during their own labors. The popularity of these saints reflects just how terrified medieval people were of the birthing process. The political implications were equally significant. Royal and noble succession depended entirely on women successfully producing male heirs, despite the enormous risks involved. The inability to produce surviving sons could destabilize entire kingdoms. Think about the English royal family during this period. How many political crises were caused by queens dying in childbirth before producing male heirs? How many wars of succession happened because royal women couldn't survive long enough to secure the dynasty? The Wars of the Roses, the 100 Years' War, some of these conflicts had roots in the simple biological fact that medieval women died having babies. Queens and noble women were under incredible pressure to keep getting pregnant until they produced surviving male heirs, even if previous pregnancies had nearly killed them. Their personal survival was less important than their political function as producers of legitimate offspring. This created a situation where some of the most powerful women in medieval society were also among the most endangered. Being a queen didn't protect you from the horrors of medieval childbirth. It might actually make them worse, because the pressure to keep trying for male heirs was relentless. The cultural attitudes toward women that developed during medieval times were deeply shaped by the realities of childbirth mortality. Women were seen as simultaneously sacred and cursed, essential and expendable, powerful and vulnerable. They had the miraculous ability to create life, but they were constantly dying in the attempt. This contradiction created complex social attitudes that persisted long after medical advances made childbirth safer. The idea that women were naturally suited for suffering, that they were morally responsible for the pain of childbirth, that their primary value lay in their reproductive capacity. These concepts were reinforced by centuries of horrific maternal mortality. Medieval literature and art are full of references to the dangers of childbirth,
but they're often romanticized or presented as noble sacrifice. The reality of women screaming in agony for hours before dying was transformed into poetic metaphors about the price of bringing life into the world. The development of medieval medicine was profoundly affected by attitudes toward childbirth. Because birth was seen as women's work and divine punishment, there was little incentive for male physicians to study it or develop better treatments. The most dangerous medical condition affecting half the population was largely ignored by the people who had the education and resources to potentially improve it. This medical neglect had consequences that extended far beyond childbirth itself. The lack of understanding about female anatomy and reproductive health affected medical treatment of women in all areas. Medieval physicians had detailed knowledge about male bodies, but remained largely ignorant about female physiology. The economic impact of losing so many women in their prime reproductive years was enormous, but largely invisible in medieval record keeping. These weren't deaths that happened on battlefields or during dramatic events that chroniclers wrote about. They were deaths that happened in private homes, attended only by other women, often not even recorded in official documents. But the cumulative effect was staggering. Entire communities would lose significant portions of their reproductive age female population every generation. The social and economic disruption this caused was immense, but it was normalized because it had been happening for so long that nobody could imagine any other way. The psychological impact on medieval society is something we can barely comprehend today. Imagine living in a world where every pregnancy announcement is tinged with the knowledge that it might be a death sentence, where every wedding is shadowed by the statistical likelihood that the bride will die young in childbirth, where every family expects to lose multiple women to the process of creating the next generation. This created a culture that was simultaneously deeply invested in protecting pregnant women and resigned to losing them. Families would do everything they could to help women through pregnancy and childbirth, while also preparing for the very real possibility that they wouldn't survive. The resilience required to function in such a society is remarkable. People had to find ways to love deeply while accepting loss as inevitable. They had to celebrate new life while grieving the women who died creating it. They had to maintain hope for the future while living with constant tragedy in the present. And here's what really gets to me about the bigger picture of medieval childbirth. It was preventable. Not all of it, not with medieval technology, but so much of the death and suffering was caused by ignorance, superstition, and social attitudes that actively made things worse. Better nutrition, cleaner birthing practices, basic understanding of anatomy, effective pain relief. These weren't impossible goals with medieval technology. They were achievable improvements that could have saved thousands of lives. But social, religious, and cultural factors prevented these advances for centuries. Saints associated with childbirth became some of the most popular in medieval Christianity. Women prayed desperately to Saint Margaret of Antioch, Saint Gerard Majella, and others, hoping for protection during their own labors. The popularity of these saints reflects just how terrified medieval people were of the birthing process. The political implications were equally significant. Royal and noble succession depended entirely on women successfully producing male heirs, despite the enormous risks involved. The inability to produce surviving sons could destabilize entire kingdoms. Think about the English royal family during this period. How many political crises were caused by queens dying in childbirth before producing male heirs? How many wars of succession happened because royal women couldn't survive long enough to secure the dynasty? The Wars of the Roses, the 100 Years' War. Some of these conflicts had roots in the simple biological fact that medieval women died having babies. Queens and noble women were under incredible pressure to keep getting pregnant until they produced surviving male heirs, even if previous pregnancies had nearly killed them. Their personal survival was less important than their political function as producers of legitimate offspring. This created a situation where some of the most powerful women in medieval society were also among the most endangered. Being a queen didn't protect you from the horrors of medieval childbirth. It might actually make them worse, because the pressure to keep trying for male heirs was relentless. The cultural attitudes toward women that developed during medieval times were deeply shaped by the realities of childbirth mortality. Women were seen as simultaneously sacred and cursed, essential and expendable, powerful and vulnerable. They had the miraculous ability to create life, but they were constantly dying in the attempt. This contradiction created complex social attitudes that persisted long after medical advances made childbirth safer. The idea that women were naturally suited for suffering, that they were morally responsible for the pain of childbirth, that their primary value lay in their reproductive capacity. These concepts were reinforced by centuries of horrific maternal mortality. Medieval literature and art are full of references to the dangers of childbirth, but they're often romanticized or presented as noble sacrifice. The reality of women screaming in agony for hours before dying was transformed into poetic metaphors about the price of bringing life into the world. The development of medieval medicine was profoundly affected by attitudes toward childbirth. Because birth was seen as women's work and divine punishment, there was little incentive for male physicians to study it or develop better treatments. The most dangerous medical condition affecting half the population was largely ignored by the people who had the education and resources to potentially improve it. This medical neglect had consequences that extended far beyond childbirth itself. The lack of understanding about female anatomy and reproductive health affected medical treatment of women in all areas. Medieval physicians had detailed knowledge about male bodies, but remained largely ignorant about female physiology. The economic impact of losing so many women in their prime reproductive years was enormous, but largely invisible in medieval record keeping. These weren't deaths that happened on battlefields or during dramatic events that chroniclers wrote about. They were deaths that happened in private homes, attended only by other women, often not even recorded in official documents. But the cumulative effect was staggering. Entire communities would lose significant portions of their reproductive age female population every generation. The social and economic disruption this caused was immense, but it was normalized because it had been happening for so long that nobody could imagine any other way. The psychological impact on medieval society is something we can barely comprehend today. Imagine living in a world where every pregnancy announcement is tinged with the knowledge that it might be a death sentence, where every wedding is shadowed by the statistical likelihood that the bride will die young in childbirth, where every family expects to lose multiple women to the process of creating the next generation. This created a culture that was simultaneously deeply invested in protecting pregnant women and resigned to losing them. Families would do everything they could to help women through pregnancy and childbirth, while also preparing for the very real possibility that they wouldn't survive. The resilience required to function in such a society is remarkable. People had to find ways to love deeply while accepting loss as inevitable. They had to celebrate new life while grieving the women who died creating it. They had to maintain hope for the future while living with constant tragedy in the present. And here's what really gets to me about the bigger picture of medieval childbirth. It was preventable. Not all of it, not with medieval technology, but so much of the death and suffering was caused by ignorance, superstition, and social attitudes that actively made things worse. Better nutrition, cleaner birthing practices, basic understanding of anatomy, effective pain relief. These weren't impossible goals with medieval technology. They were achievable improvements that could have saved thousands of lives. But social, religious, and cultural factors prevented these advances for centuries.
The tragedy of medieval childbirth isn't just that it was dangerous, it's that it remained unnecessarily dangerous for so long, because changing it would have required challenging fundamental beliefs about women, medicine, religion, and society itself. Understanding this history helps us appreciate not just how far we've come medically, but how much of what we consider natural or inevitable about women's experiences was actually the result of specific historical circumstances. The horror of medieval childbirth wasn't natural. It was the product of a society that organized itself in ways that made women's deaths acceptable, collateral damage in the process of maintaining itself. And that's a lesson we still need to remember today, because even now, with all our medical advances, women around the world are still dying in childbirth at rates that would shock medieval people. The tools to prevent these deaths exist, but the social, economic, and political will to use them universally doesn't. Medieval childbirth was a nightmare, but it was a nightmare that shaped everything about the world those people lived in, and its echoes still resonate in ways we're only beginning to understand. Here's the thing about medieval records. They were kept by men, about men, for men. The chroniclers who documented battles and political events and religious ceremonies rarely bothered to record the deaths of women in childbirth. These weren't considered historically significant. They were just expected. But sometimes, when the woman was important enough, or when the circumstances were dramatic enough, or when the death had political implications, these stories managed to slip through the cracks of historical amnesia. And what we find in these scattered records is both heartbreaking and illuminating. Let me tell you about some of the women whose stories survived, and what they tell us about the countless others whose names are lost forever. Isabella of Valois was Queen of England, married to Richard II when she was just 6 years old. She died in childbirth in 1409 at the age of 19, trying to give birth to her first child with her second husband. The chroniclers recorded her death because she was royalty, but they wrote about it the way you might write about a horse dying, regrettable but not particularly shocking. The queen died in labor, as women do, one chronicle notes, with the casual resignation that makes your heart break. What gets me about Isabella's story isn't just that she died so young, but that she spent her entire adult life preparing for this moment. From the age of 6, when she was first married, her primary purpose was to eventually produce heirs. She was trained, educated, and prepared for a role that had a 1 in 3 chance of killing her. And when it finally did kill her, the historical record barely shrugged. Then there's Blanche of Lancaster, who died in 1369 after giving birth to her 7th child. She was John of Gaunt's first wife, and her death devastated him so completely that he didn't remarry for 4 years, which was actually unusual for a medieval nobleman. What's interesting about Blanche's story is that we have records of her previous pregnancies, and they show the classic pattern of medieval royal childbearing. She had her first child at age 18, then another at 20, another at 22, and so on, with barely a year between pregnancies. Each birth weakened her further, but she kept getting pregnant because that was her job. By the time she had her 7th pregnancy, her body was worn out from constant childbearing. The birth that killed her might have been survivable if it had been her first or second pregnancy, but it was the cumulative effect of years of medieval obstetrics that finally did her in. What's haunting about Blancombe's story is that we have a poem Geoffrey Chaucer wrote about her death, the Book of the Duchess, where he describes her husband's grief. But even in this beautiful, touching tribute to a woman's life, Chaucer focuses entirely on the husband's loss. Blancombe herself remains a shadowy figure, defined entirely by how much her death affected the men around her. Let me tell you about a woman whose story is more typical but equally tragic. We don't even know her real name. She's recorded in a 14th century manor court roll, simply as Agnes, wife of Thomas the Miller. Agnes died in childbirth in 1348, during the Black Death, and we only know about her because her death caused a legal dispute over who would inherit the mill. The court records tell us that Agnes had been in labor for 3 days. 3 days. The local midwife had tried everything she knew, but the baby was positioned wrong and couldn't be delivered. On the 3rd day, Agnes began hemorrhaging and died within hours. The baby died too. What makes Agnes's story so devastating is how ordinary it was. The court clerk recorded it with the same matter-of-fact tone he used for recording property disputes and cattle thefts. A woman labored for 3 days and died, leaving behind a husband and 3 young children. Just another day in medieval England. But here's what the record doesn't tell us, what those 3 days were like for Agnes. The pain, the exhaustion, the growing fear as hour after hour passed without progress, the desperation of the women trying to help her, the helplessness of her husband waiting outside, the terror of her children who could hear their mother's cries through the walls. The record doesn't tell us that Agnes probably knew she was dying long before she actually died. that she spent her final hours thinking about the children she was leaving behind, the baby she couldn't save, the husband who would have to find another wife to care for her surviving children. Royal deaths get recorded, but peasant deaths like Agnes's usually disappear completely from history. We only know about her because of a legal technicality. How many thousands of other women died exactly like this, leaving no trace at all? Let me tell you about Margaret Beaufort, who survived medieval childbirth, but whose story shows just how traumatic the experience could be, even when it didn't kill you. She gave birth to the future Henry VII in 1457 when she was just 13 years old. 13. The birth was so difficult and traumatic that she never had another child, despite being married 3 more times. Think about what that means. A 13-year-old girl went through a labor so horrific that her body was permanently damaged. She lived for nearly 50 more years, was married to powerful men who desperately needed heirs, but she never conceived again. The medical term for this is probably severe internal trauma from the birth, but medieval records don't go into those details. Margaret Beaufort became one of the most powerful women in England, the mother of a king, a patron of education and religious causes. But she was also a woman whose life was defined by a single traumatic childbirth experience, when she was barely more than a child herself. Her story shows us something important about medieval childbirth survival. Sometimes living through it was almost as devastating as dying from it. The records of saints and miraculous survivals give us another window into medieval childbirth experiences. Saint Bridget of Sweden, who lived in the 14th century, had 8 children and supposedly experienced painless childbirth as a divine blessing. Her hagiography describes her labors as gentle and easy, with no suffering or danger. But here's what's interesting about Saint Bridget's story. The fact that painless childbirth was considered miraculous tells us everything about what normal childbirth was like. The idea that a woman could give birth without agony was so impossible that it required divine intervention to explain. Even more telling are the stories of women who prayed to Saint Bridget for help during difficult labors. Medieval records are full of accounts of women who called on her intercession when their births were going badly. Some of these stories have happy endings. The woman recovers, the baby survives, everyone credits Saint Bridget with a miracle. But what about the women who prayed just as desperately and still died? Their stories don't get recorded as miracles. They just become more evidence that God's will is mysterious, and that women's suffering in childbirth is natural and expected. The silence in medieval records is often more telling than what's actually written down. When chroniclers record that a nobleman remarried after his wife died, they usually don't bother to mention how she died. But when you see records of men who went through 3, 4, 5 wives, the pattern becomes clear. These weren't marriages that ended in divorce or annulment. They were marriages that ended in the birthing chamber. Take William Marshall, one of the most famous knights of medieval England. He was married to Isabella of Valois, who gave him 5 children before dying in 1220. The chronicles mention her death in passing, as just one of those things that happened. But when you look at the timing of her pregnancies, you can see the familiar pattern: constant childbearing until her body gave out. Isabel had her first child around 1200, then children in 1202, 1205, 1208, 1210, and died giving birth to her 6th child in 1220. 20 years of almost constant pregnancy, childbirth, and nursing. Her body never got a chance to recover between pregnancies, and eventually it just couldn't handle anymore. The really heartbreaking part of Isabel's story is that we have evidence she was an intelligent, capable woman who managed vast estates and had political influence. But none of that mattered when it came to her primary function as a medieval wife, producing heirs. Her intellectual abilities, her administrative skills, her personal desires, all of that was secondary to her biological role. Sometimes medieval records give us glimpses of the emotional toll that constant pregnancy and infant death took on families. There's a 13th century chronicle that mentions a woman named Matilda who gave birth to 12 children over 18 years. Only 3 survived to adulthood. The chronicler notes this almost in passing, as an example of God's mysterious ways. But think about what Matilda's life was like. 18 years of pregnancy, childbirth, nursing, and grief. 9 dead babies. The emotional trauma of losing child after child, while knowing that she had to keep trying because the family needed surviving heirs. Medieval people didn't have the luxury of stopping after losing a few children. They couldn't say, "This is too painful, we're done having kids." They had to keep going, keep getting pregnant, keep hoping that the next child would be the one who survived, all while carrying the grief of all the children they'd already lost.
The records of medieval convents sometimes give us different perspectives on childbirth, because nuns were the only women who could choose not to have children. Some of the writings from medieval abbesses show a clear awareness of what they were avoiding by choosing religious life. Hildegard of Bingen, the 12th century abbess and mystic, wrote about women's bodies and health in ways that suggest she understood how dangerous childbirth was. She never explicitly says, "I'm glad I didn't have to go through that," but there's a subtext in her writings that suggests she knew exactly what she had escaped by becoming a nun. Other medieval religious writings show interesting tensions around childbirth. On one hand, it was seen as women's sacred duty, blessed by God. On the other hand, it was also seen as punishment for original sin, something women had to endure as penance. This contradiction shows up in the records of how medieval people actually talked about childbirth. Publicly, it was celebrated as a blessing and a miracle. Privately, the records suggest that people understood it was dangerous and often tragic. The account books of medieval households sometimes give us insights that the official chronicles miss. When a household suddenly starts hiring wet nurses, you can infer that the lady of the house either died in childbirth or was too sick to nurse. When expenses for midwives and herbs spike, you know someone was having a difficult labor. These financial records don't tell dramatic stories, but they give us a glimpse into the economic reality of medieval childbirth. The cost of hiring additional help when a birth went badly, the expense of trying multiple remedies for difficult labors, the financial impact of losing the woman who managed the household. What strikes me most about these fragmentary records is how they reveal the disconnect between individual tragedy and social acceptance. Each of these women, Isabella, Blanche, Agnes, Margaret, Matilda, was a person with hopes, fears, dreams, relationships. Each death was a devastating loss for the people who loved them. But medieval society had organized itself around the expectation that women would die in childbirth. It was factored into marriage contracts, inheritance laws, social customs, religious doctrine. Individual tragedies were absorbed into a system that treated women's deaths as regrettable but inevitable overhead costs of maintaining civilization. The women whose stories survived did so mostly by accident, because they were royal, because their deaths caused legal problems, because they became saints, because their husbands were important enough to mention in chronicles. For every story we have, there are thousands of others that disappeared completely. But even these scattered fragments tell us something important. Medieval women knew exactly how dangerous childbirth was, and they chose to face that danger anyway. Not because they were ignorant of the risks, but because they understood that bringing new life into the world was worth risking their own lives for. That courage, repeated millions of times across medieval Europe, is what built the foundation for everything that came after. These weren't just medical statistics, they were individual acts of bravery that shaped the course of human history. So after centuries of this nightmare, after generations of women dying in birthing chambers, while everyone just accepted it as God's will, you might wonder, what finally changed? What broke the cycle of ignorance and superstition that kept medieval childbirth so deadly for so long? The answer is complicated, because change came slowly, unevenly, and often met with fierce resistance. But it did come, and understanding how helps us appreciate just how revolutionary the idea of safer childbirth really was. The first cracks in the medieval approach to childbirth actually came from an unexpected source: Islamic medicine. While European physicians were still arguing about whether women had souls and practicing bloodletting as a cure for everything, Islamic scholars were making actual medical advances. Physicians like Al-Razi and Ibn Sina, known in Europe as Avicenna, were writing detailed medical texts that included surprisingly accurate information about pregnancy and childbirth. They understood anatomy better than their European counterparts. They had developed surgical techniques that actually worked, and they approached medical problems with something resembling scientific method. When these Islamic medical texts started being translated into Latin during the 12th and 13th centuries, they brought revolutionary ideas to European medicine. For the first time, European physicians had access to accurate descriptions of female anatomy, practical advice for managing difficult births, and the radical notion that medical intervention could actually help rather than harm. But here's the thing about medieval Europe: new ideas, especially ones that came from Islamic sources, were not exactly welcomed with open arms. The Christian Church was suspicious of any knowledge that came from Muslim scholars, and the existing medical establishment had a vested interest in maintaining their current practices, however useless they might be. So change was slow, very slow. The new knowledge filtered into medical schools gradually, often disguised or reinterpreted to make it more acceptable to Christian sensibilities. Physicians started incorporating some Islamic techniques into their practice, but they often mixed them with traditional European superstitions in ways that diluted their effectiveness. The Crusades, ironically, helped spread medical knowledge because European soldiers and physicians encountered Islamic medical practices firsthand. They saw surgical techniques that actually worked, hospitals that were clean and organized, and medical treatments that produced better results than anything they had back home. Some of these Europeans brought Islamic medical knowledge back with them, and gradually European medicine began to improve. Not quickly, not dramatically, but enough to make a difference in survival rates for those who could afford better medical care. The rise of universities in the 12th and 13th centuries also played a crucial role in changing attitudes toward childbirth. For the first time, medicine was being taught as a formal academic discipline rather than just a collection of folk remedies and religious beliefs. Medical schools like those in Salerno, Paris, and Bologna started producing physicians who had at least some theoretical knowledge of anatomy and disease. They were still working with incomplete and often incorrect information, but they were approaching medical problems more systematically than their predecessors. Some of these university-trained physicians began to take an interest in childbirth, which had previously been considered beneath their notice. They started writing treatises on obstetrics, developing new techniques for managing difficult births, and slowly beginning to challenge some of the more harmful traditional practices. But here's where things get interesting. The biggest obstacle to improving childbirth outcomes wasn't medical ignorance, it was social resistance. Remember, childbirth was women's domain. It was managed by midwives, attended by female relatives and neighbors, and considered something that men should not be involved in. When male physicians started trying to intervene in childbirth, they met with fierce resistance from the women who had been managing it for centuries. And honestly, this resistance was often justified. Early attempts by male physicians to improve childbirth often made things worse. These men had theoretical knowledge, but no practical experience. They had never actually attended a birth. They didn't understand the normal process of labor, and their interventions were often more dangerous than the traditional practices they were trying to replace. The first male physicians to attend births were usually called in only when the situation was desperate, when the woman was clearly dying and the midwife had given up hope. These physicians would attempt dramatic interventions, usually involving crude surgical procedures performed without anesthesia or proper sterilization. Most of these attempts failed, which reinforced the belief that men had no business in the birthing chamber. But gradually, some male physicians began to develop more effective techniques. They learned from experienced midwives, studied the translated Islamic texts, and began to understand the mechanics of childbirth better than anyone had before. One of the breakthrough developments was the improvement of surgical instruments. Islamic influence led to better understanding of metallurgy and tool-making, which resulted in more precise and effective surgical instruments. Instead of the crude hooks and knives that medieval midwives used in desperate situations, physicians began developing specialized obstetric tools. The obstetric forceps, for example, were developed in the late medieval period. and represented a huge advance in the ability to assist with difficult deliveries. Instead of trying to dismember a stuck baby, physicians could now sometimes extract them alive. The survival rates for both mothers and babies in complicated births improved dramatically when these tools were used by skilled practitioners. But access to these improved techniques was limited to the wealthy. Poor women were still dependent on traditional midwifery, which meant that the improvements in childbirth outcomes were concentrated among the upper classes. This created a growing gap in maternal mortality rates between rich and poor that would persist for centuries. The Black Death, paradoxically, also contributed to changes in childbirth practices. The massive population losses caused by the plague created labor shortages that made women's survival more economically valuable. For the first time in medieval history, there was genuine economic incentive to keep women alive through their childbearing years. This led to increased investment in medical care for women, better nutrition for pregnant women in some areas, and more willingness to try new approaches to managing difficult births. The plague also killed many traditional midwives, creating opportunities for new practitioners with different training and approaches to enter the field. The Renaissance brought with it a new attitude toward learning and innovation that affected medicine, including obstetrics. The rediscovery of classical Greek and Roman medical texts provided additional sources of knowledge about anatomy and medical practice. More importantly, the Renaissance emphasis on observation and experimentation began to influence medical practice. Instead of relying entirely on traditional authorities, some physicians began to observe what actually happened during births and to modify their techniques based on what they learned.
Leonardo da Vinci's anatomical studies, for example, included detailed drawings of pregnant women and developing fetuses that were far more accurate than anything that had been available to medieval physicians. This improved understanding of anatomy made it possible to develop more effective interventions for complicated births, but perhaps the most important change was gradual shift in social attitudes toward women's suffering. The medieval belief that women's pain in childbirth was divinely ordained and morally necessary began to be questioned by some religious and medical authorities. This change was slow and often controversial. Many people continued to believe that attempting to reduce women's suffering in childbirth was contrary to God's will, but gradually, the idea that human intervention could and should be used to preserve life began to gain acceptance. The development of better midwifery training also played a crucial role in improving outcomes. Instead of learning entirely through oral tradition and apprenticeship, midwives began to have access to written manuals that describe best practices for managing births. These manuals, often written by physicians who had studied Islamic medical texts, provided midwives with more accurate information about anatomy, better techniques for managing complications, and clearer guidance about when to seek additional help. The improvement in general health and nutrition that occurred in some parts of Europe during the later medieval period also contributed to better childbirth outcomes. Women who were better nourished and in better overall health were more likely to survive pregnancy and childbirth. This was partly due to economic recovery after the Black Death, partly due to improvements in agricultural techniques, and partly due to better understanding of the relationship between diet and health. The results were gradual, but measurable improvements in maternal and infant mortality rates in areas where living conditions improved, but resistance to change remained strong throughout the medieval period and beyond. The Catholic Church continued to teach that women's suffering in childbirth was divinely ordained. Traditional midwives resisted new techniques that challenged their established practices. Male physicians often dismissed obstetrics as beneath their professional dignity. Progress was also hampered by the lack of effective communication between different groups involved in childbirth. Physicians who developed new techniques often didn't share them with midwives. Midwives who discovered effective practices often didn't have ways to communicate them to physicians or to midwives in other regions. The result was that improvements in childbirth care were sporadic, localized, and often temporary.
A community might develop better practices under the influence of a particularly skilled physician or midwife, only to revert to traditional methods when that person died or moved away. What's remarkable about this period of slow change is how it reveals the complex interplay between medical knowledge, social attitudes, economic incentives, and cultural resistance. Improving childbirth outcomes required not just better medical techniques, but fundamental changes in how society valued women's lives and approached medical care. The turning point in medieval childbirth wasn't a single dramatic breakthrough, but rather a gradual accumulation of small improvements that slowly shifted the odds in favor of survival. Better knowledge of anatomy, improved surgical techniques, more effective training for midwives, better nutrition, and slowly changing social attitudes all contributed to making childbirth somewhat less deadly. But even these improvements were limited and uneven. For most women, for most of the medieval period, childbirth remained a terrifying ordeal with horrific mortality rates. The real transformation in childbirth safety wouldn't come until much later, with the development of modern medicine, antibiotics, and surgical techniques. Still, the late medieval period planted the seeds of change that would eventually bloom into safer childbirth. The idea that human knowledge and intervention could improve medical outcomes, the gradual acceptance of male physicians in obstetrics, the development of better surgical instruments, and the slow recognition that women's suffering was not necessarily divinely mandated. All of these changes laid the groundwork for future improvements. The women who lived through this transition period were still facing terrible odds, but they were slightly better odds than their mothers and grandmothers had faced. And that small improvement multiplied across thousands of births, saved countless lives, and pointed toward the possibility of a future where bringing life into the world didn't require gambling with death. And just like that, we're back to our world of epidurals and ultrasounds, cesarean sections and IQs, where maternal mortality rates are measured in fractions of percentages rather than ratios that would make a statistician weep. Take a deep breath. Feel that relief washing over you as you remember that the woman reading this has roughly a 99.98% chance of surviving childbirth if she ever chooses to go through it. But here's what I want you to sit with for a moment. Everything we just experienced together, all those women whose stories we witnessed, the terror and pain and impossible courage we walked through, that was real. That was the lived experience of millions upon millions of women across centuries of human history. Isabella of Valois, Blanche of Lancaster, Margaret the midwife, Agnes the miller's wife. They weren't characters in a horror story. They were real people whose lives and deaths shaped the world we inherited. And here's the thing that really gets to me. Their courage wasn't different from the courage of women today. They didn't face those birthing chambers because they were braver than us, or more accepting of pain, or less concerned about their own survival. They faced them because they loved their children, because they wanted families, because bringing new life into the world felt worth the risk, even when the risk was staggering. That same love, that same hope, that same fierce determination to create life, despite the odds, that's happening in delivery rooms around the world right now. The circumstances are infinitely better. The medical support is miraculous by medieval standards, but the fundamental human experience of bringing a child into the world remains achingly, beautifully the same. But let's not forget that medieval childbirth isn't entirely history. Right now, as you're reading this, women around the world are still dying in childbirth at rates that would shock our medieval ancestors. In some parts of the world, maternal mortality rates are higher than they were in medieval Europe. The tools to prevent these deaths exist: antibiotics, surgical techniques, trained medical personnel, blood transfusions, but the social, economic, and political will to make them universally available doesn't. The nightmare of medieval childbirth teaches us something crucial, that women's deaths in childbirth are never inevitable. They're always the result of specific circumstances, specific choices, specific systems that value some lives more than others. The horror wasn't that medieval women died giving birth, it's that they continued dying for so long, because their society accepted those deaths as natural and unavoidable. So when you see those gender reveal parties on social media, when you hear pregnancy announcements filled with joy and excitement, when you witness the casual confidence with which modern parents plan for their children's arrivals, remember that this confidence, this joy, this expectation that everyone will survive the process is one of humanity's greatest achievements. But also remember the women who didn't live to see this achievement. Remember their courage, their love, their hope against impossible odds. To remember that the world we live in was built on their sacrifices, their strength, their willingness to face death to bring forth life. Then maybe, if you're so inclined, take a moment to appreciate the absolute miracle of modern medicine. Because every woman who survives childbirth today is standing on the shoulders of countless others who didn't, and whose courage made it possible for us to be here, together, sharing this story across the centuries. Thank you for taking this journey with me. Thank you for witnessing these women's stories with me, for sitting with the difficult truths about our shared human history, for remembering the ones who came before us. If you found something meaningful in this exploration of our past, if it changed how you think about the present, then maybe, only if it feels right to you, consider sharing it with others who might also find meaning in these forgotten stories. The conversation continues in the comments. As always, let me know what struck you most deeply about this journey we just took together. Until next time, take care of yourselves, and remember how extraordinary it is that we're all here at all.